Hi, I'm Deb Blashenberg. I'm the founder here of the Prenatal Yoga Center. I'm also a labor support doula, Lamaze teacher, and mother of two. So as people are coming on, I just want to hear what we're going to talk specifically about pregnancy and back pain. But if you're pregnant or were pregnant or have pregnant friends, just kind of shout out what some of the common issues were, because we might touch upon those too. But today we're specifically going to go about back pain and yoga. So if you had back pain when you were pregnant, either do a heart or say yes or a little thumbs up. If you had something else that maybe we can try to fit into this session too. A little bit of back pain out there. It's actually one of the most common pregnancy issues. So I found the last several Periscopes we've been talking about a lot of the doula world and childbirth ed. So I thought we'd kind of get back to my roots. So I've been teaching yoga for about 15 years. SI joint pain, I know we're certainly going to talk about that. In fact, I've got my pelvis all ready to talk about some sacroiliac pain. So I've been teaching yoga for about 15 years. And I started specializing in prenatal yoga about 14 years ago, and I opened a studio here about 13 and a half years ago. And before I had this particular space, I was teaching elsewhere for about 8-ish months, and then that room I was teaching at got converted into a dressing room, so I had to find a new space. So the pregnant body is so interesting, and it's so interesting that I find a lot of care providers say, as long as you did it before pregnancy, you can keep doing it, and I don't 100% agree with that, because the pregnant body isn't the same. Things change and we need to address that. And specifically in our yoga practice, I'm not going to talk about all the do's and don'ts of yoga today. We can do that another time. But specifically the back, and a lot of that has to do with the pelvic changes and the weight distribution. So let's talk about just the spine, the pregnant spine. So as the belly grows, the spinal curves have to adjust. So you have 3 curves of your spine. You have your lower back, the lumbar, and it has a natural sway. And when you get pregnant, that lumbar curve exaggerates. And in fact, all the curves exaggerate. And then you have your mid-back, the thoracic. So as the lower back sways more, to balance that, the mid-back, kind of that broad strap line, the thoracic, rounds more. And then the cervical spine, the neck, arches more too, so the chin sticks out. So the curves just get exaggerated. So that's where a lot of the lower back pain comes from. We're going to talk about all the back pain, the lower, the middle, and the upper. And so that's something that in general, a lot of women will say, oh, I have neck pain, but I don't think it's related to pregnancy. It certainly is. Or they'll be like, oh, I'm having shoulder pain. Oftentimes, or even carpal tunnel, that's related to the thoracic, the mid-back rounding more, compressing the shoulder. And of course, there's general lower back pain, because these big, deep muscles in the lower back, the QL, the quadratus lumborum, are in a contracted state. And so that can create a lot of issues. So we're going to go over some poses you can do. But now let me pull out one of my favorite things to talk about, the sacroiliac joints. So here's your pelvis. Let me get a little bit closer so you can get a sense. Those are just coming on, they're like, what is that big bony thing? That is your pelvis. So your pelvis is made up of 3 bones. There's different landmarks to the pelvis, but just 3 bones. You have your 2 inanimate bones, or basically the hip bones here. And then in the back, you have your sacrum. Now, the lumbar spine and the tailbone are not specifically, well, the tailbone's part of the sacrum area, but the lumbar is its own part of the spine. And it's interesting because the sacrum is part of the pelvis as well as part of the spine. So I'm going to loosen these up and get them even closer. So one big culprit of back pain, the SI joints. So here's your sacrum, and here's your 2 innominate bones, and here's so it's called the sacroiliac joints, and here's the ilium. And here's where the discomfort tends to be. It's where the 2 innominate bones meet the sacrum. And the reason for that is because during pregnancy, we have all these wonderful hormones that are going to help soften so that the pelvis can open so the baby can come through. However, it causes instability. So as these bones, as the ligaments and the tendons, due to relaxin, soften everything, and progesterone, that's a hormone that softens your smooth muscle tissue. As everything gets softer, the pelvis gets unstable. So these 3 bones, instead of being more stable, more together, they start to expand. And the 2 SI joints, on the left and right, they can shift a little. So one side of the pelvis can be anterior, shift forward, one side can shift posterior. And so that's where these two dimples in the lower back. So if you're not quite understanding the bony pelvis, if you look in the mirror, pull the pants down a little bit and lift your shirt, the flat part where a lot of people have tattoos, there's usually two dimples. Those are your SI joints. So a lot of women come in and say like, oh, I'm having lower back pain. And I'll say, you know, can you tell me where that pain is? And they'll point to, they usually put their thumb right on their SI joint. And it's the left and right of the sacrum. And if they say it's the band in the lower back, that's more muscular. So we want to focus on the SI joints because a lot of the poses we do in yoga, well not a lot, many of the poses we do in yoga can actually worsen it. So the reason we're so specific here at Prenatal Yoga Center is because we want to make sure that we don't worsen the situation. We don't want the mom to leave more uncomfortable than when she came in. So let's do a few poses. So if you're up for it, you can follow me, and we're going to do a few poses to try to alleviate the back. Before we get on doing some yoga, one more thing about the SI joints. A lot of times people say, oh, I'm having sciatica, and I'll ask them to point where it is, and they point to the SI joints. So sciatica, true sciatica is an impingement of the nerve in the lumbar spine, and it often shows up in the glutes and kind of a radiating discomfort right in the glutes. So that's more nerve and muscular because the piriformis is often irritated. That's a deep muscle in the butt. So if you're thinking, I don't know if I have SI, sacroiliac pain, or sciatic or piriformis, touch your body, because if it's the lower back, if you're touching the bony part of your back, then that's SI. If you're touching like the meaty glute, then that's either your piriformis, this deep internal or external rotator in the glutes, or your sciatic nerves. So they're two different things. And a lot of care providers are like, oh, you have sciatica, when in fact it's more the SI. All right, so I'm seeing some people agree with that and probably have been diagnosed with that. So let's address some back pain. So some of the poses we're going to do, the yoga asanas, they're great even if you are not pregnant. So if you're tuning on and you're just feeling a little achy, maybe you've been at your computer a while and you're all hunched over, or here in New York City it's really cold, so I find myself walking down the street all coiled in on myself. So let's just do some stuff to release the neck, the shoulder, the upper back, the trapezius, the mid back, and the lower back. So we're gonna do some seated stuff since the camera's already set up this way. And then I'm gonna do some stuff on all fours and a little bit of down dog. And at that point, I'll ask Ursula to swing the camera around so that I'm not trying to see what's going on the screen and try to do my poses. So who's ready for a little yoga? Tap your screen, some hearts if you're ready for some asana, and open up the back, relieve some tension. Oh, I see a lot more people joining, thank you. And if you have some followers, or who just popped on? Hey, hi Alex. So if you want to tweet this on Twitter or invite your followers to do a little yoga, feel free, take a moment, send that out, because I think many of us suffer from back pain just from daily life and poor sitting. So if you're having any sort of lower back pain in particular and want to do a little bit of yoga together, sit on some sort of prop so that your knees are in line with your hips. So here I am, I'm going to sit on my bolster. And you can see immediately my knees drop down. If you're sitting and your knees are hiked up, it's going to just tighten your hips. So you can sit on a blanket, a pillow, a bolster, so just that you have a little bit of ease in the lower back. All right, so we're just going to start with a little bit of releasing the neck, since the neck is still part of the spine, it's part of the back. I'm just going to do a little bit of head circles from side to side. And just notice how that feels. Oh, I just got a little crack and pop in my neck. Oh, feels good to release. And then I like to take some time to really focus on one side. So draw the head over towards the right. So I'm going to mirror you because that's how I teach. And then extend your left arm out. And you should notice a deeper stretch here on the side of the neck. And then as you inhale, drop the chin down, and you'll notice more the front. And as you exhale, roll the chin up. And on your own, just gonna release the head from side to side. I never really looked at myself doing this. I have a very flexible neck, so sorry, that's a little freakish. And then roll your head the other way.
Can I do that if I have back pain?
Yes, unless you have a slip disc in your neck, yes. And now reach the right arm out, head over to the left, and again, just moving the neck up and down. And hopefully you're feeling a little bit of release here. Good, and then drop your chin to your chest and roll the shoulders back. And as the chin drops down, the weight of the head drops down, the shoulders go back. Now you should feel the back of the neck stretch a little bit. Good. and then lift yourself up. Now we're going to work just a little bit of, I call it seated cat-cow. So bring your hands onto your knees. Let me back up a little more so you can see me. And it's more about the whole body moving. So as you inhale, lift the chest, open the heart, and as you exhale, hold onto the knees and round your back. So we're creating a C curve. So first we lift the heart, and we exhale, hold the knees, and round the back. And this should feel pretty good through the middle back. Oh, I see some hearts. People are loving some yoga. It's one of my favorite pastimes. Good, so that's just a nice general warm up there. Now let's get a little bit more to the mid back. So I call these your cactus arms. And now let's take your right arm under your left. Cross your elbows and your wrists. So basically you can see I just drew the elbows together, press the palms together. Now squeeze the arms and then just move the arms up and down. And if you really press your palms together, you should feel the trapezius, the upper traps, and between the shoulder blades open up. So this is one of my favorite things to do at night after I've been sitting at the computer or with my kids or just any sort of stress. And when you do it both sides, so open the arms wide, and now take your left arm under your right, press the palms together, and again move the arms up and down. Oh, I'm seeing some hearts. Again, feeling good for the back. And mostly it's important to find your breath. If we're not breathing while doing the poses, it's really counterproductive. All right, good. And then release the arms, roll the shoulders. All right, so those just popping on. We're working on some asanas, yoga poses to relieve the back. So we're starting kind of from the top down. So we did the neck, we just did the middle upper back. Now let's start to get to the side a little bit, because as we side stretch, as I was talking about specifically for pregnancy, the lower back muscles, those deep QL muscles, quadratus lumborum, they can get really tight. And so side stretching is a great way to do it. And in general, again, most of us are kind of slumped. So lift the armpits, release your shoulders, and then inhale the right arm up, and we're just taking a general side stretch. So anchor the right hip, and then open the whole side waist. Good. Now I want to start to incorporate more of the mid back here. So we're going to inhale, open the chest, and then as you exhale, draw the chest down and reach the arm out. So now I'm hitting right in those back ribs. Oh, I love seeing that you guys are enjoying this. Inhale the heart up, and then exhale, reach the arm out. One more time, inhale the heart up, and exhale, reach the arm out. Oh, good. And then just lift up and notice how that feels. And so we want to take a moment not just to do these poses, but to also embody them. So yesterday, my daughter insisted on not going on this, taking the stroller, and then as soon as we're at the door, she wanted to be carried. So I carried her for 8 blocks. So this feels particularly good for me, and any other mamas out there, I bet it feels good for you too. Inhale the left arm up, and then take your side stretch. Release the hip, open the side body, and then as you inhale, open the chest. As you exhale, draw the chest down, reach the arm out. Inhale, open the heart, and exhale as you reach. One more time, inhale, open the heart, and exhale as you reach. Good, and then let's lift up. All right, so now we've done neck, mid-upper back, and a little bit of the lower back with those side stretches. So again, those are popping on. We're working on some back stuff. Now we're going to start to get onto all fours. And we're going to look, I'm going to remind you guys about remember the SI joints, the sacroiliac joints, those 2 panes at the bottom of the sacrum, at the side of the sacrum, the left and right side. What we don't want to do, so we actually want to work on stabilizing that. So ground the hands. So you're going to tuck the toes and inhale, draw the chest forward. Now when you're pregnant, you don't want to drop in the back, keep some support. It's more about the heart, chest reaching forward. And then as you exhale, untuck the toes, drop the head and tail, and round the back. So that again. Inhale, open the heart forward. Good, and then exhale, round. So if you're at home, just get on the floor and do a little cat-cow. So that one more time, inhale, open the heart. Exhale, round. Now let's address those lower back muscles again. So you're in cat. And then you'll just pull the hips back, and this is a great way to really stretch out this whole column of muscles. And we're going to inhale, and then exhale, and pull the hips back. Let's just do that one more time. Inhale, and exhale, pull the hips back, and hopefully that feels great. Now, that's great for everyone with back pain. You don't even have to worry. If you're SI, that's great. So now we're just going to do something to strengthen the back a little bit. So we're going to reach the right leg back, again I'm mirroring you, and push through the heel. Good, now my SI moms, I don't want you doing this because if you lift that back leg, it creates a lot of discomfort because now it's very imbalanced, the weight of that leg. So if you're not an SI mom or dad there, you can start to lift the leg, reach the opposite arm out. So now we're lengthening. And we're drawing tail back. This is strengthening the lower back. And that's going to help some of the support we need. Good, and then we'll release down. Let's do the other side. Reach the other leg out. Tailbone draws down. Reach the opposite arm out. Lift the leg. Try to reach the heel. Abdominals are toning. One more breath. Good. All right, now we're going to do a little down dog. Down dog. I'm grounding the hands. Tucking the toes. The sit bones, the two bones, the base of the pelvis. Push the hands forward, pull the hips back. Now if you have tight hamstrings or tight shoulders, looks good?
Yeah.
You're going to come onto the balls of the feet, bend the knees, lift the sit bones. Here's the dual action. Push your hands forward, pull your hips back. If your hamstrings are open, go ahead and release the heels down, but you don't. Here's the yoga don't. You don't want to shift forward around back. More importantly, lift the heels, bend the knees, find the length in the back, let the head go, and then over time. And that is a really great stretch for the back for pregnancy. It's very hard to lengthen the whole back. Now for my SI moms, I love doing down dog with a block between the thighs because it actually gives some support to the pelvic floor. And that, when the pelvic floor is well balanced and strong but yet flexible, it's actually going to help stabilize your SI joints. So that's just a little tip for that. So I think it's almost time to end our Periscope today because we have some students coming in. Does anyone have any questions? So just a little take home. Remember, the curves of the spine are exaggerated. We want to stabilize the lower back, and we're doing the block between the thighs for my SI moms. For the opposite limb extension, SI moms, you are not lifting the back leg. You're keeping the legs, trying to keep the hips symmetrical. For also the low back, we can do side stretches. Oh, one more I want to throw in for the mid back. We're going to do a little twist. I forgot, that's one of my favorite mid back. Are we okay there?
Okay, then we're just going to make that all. There we go.
So sorry, I'm totally going out of sequence here. So we talked about the side stretching for the low back. We did the Garudasana arms for the mid back. And now we're going to do one more pose for the mid back before we have to leave for today. So this is a twist. Now when you're pregnant specifically, you want to twist above baby. When you're postpartum, you want to make sure that your abdominal muscles haven't separated too much, and that when you're twisting, you're not over twisting because we don't want to worsen that. So imagine I've got my big pregnant belly, and we'll take one hand to the side of the belly, the other hand behind, and as you inhale, lift tall, and as you exhale, you're twisting above the baby, and you're letting the neck be soft. And you're really trying to focus bra strap line and above. And then you can do the other side. Sitting tall, baby forward, bra strap line and above. Good. So then we also had cat-cow, which was getting the whole back. We had our twist for mid-back. We had our Garudasana arms, and then we had our neck circles for the cervical spine. So we're just trying to alleviate some of the discomfort that you might feel during pregnancy, because if you're more comfortable, you're just going to enjoy the experience a little bit more. And if you're uncomfortable, we're just going to keep exploring different asanas. So thank you so much for joining. Again, if there's a topic we haven't covered and that you want to talk about, please feel free to let us know, Deb at Prenatal Yoga Center. So have a wonderful weekend. Stay warm. Namaste.